this time?
You don't have. Do you want to look at this?
No. Okay.
What do you want?
That's fine. Good afternoon. Thank you. I have made it a priority as mayor to bring safety, healing, and justice to Boston communities. That means reimagining public safety in our city and delivering thoughtful solutions that address the problems we face. We must recognize that while issues of violence and public safety, I'm going to ask that the sound get fixed. That means we must recognize that while issues of violence... In April, I asked the Boston Police Department and the Office of Health and Human Services to devise a plan that would amplify the role of mental health workers and reduce the role of police officers in response to mental health crises. Today, I am pleased to deliver on that commitment. Together with Chief Marty Martinez of the Office of Health and Human Services, Chief James Hooley of Emergency Medical Services, and Deputy Superintendent Peter Messina of the Boston Police Department, my policy team, community members, and a host of others have been working together to untangle the relationships between the police and Health and Human Services when it comes to responding to mental health calls. Working together as the Mental Health Crisis Response Working Group over the last 15 weeks, this team has assessed the existing protocols for mental health crisis response, reviewed the best practices around the country for mental health responses, hosted over 10 community listening sessions with residents, community groups, elected officials, people with lived experience, and those working in the mental health field, and administered a resident survey that was offered in different languages and neighborhoods all across Boston. The community engagement process affirmed the importance of distinguishing between how we treat calls about mental health and how we treat calls about public safety. Each call should have a response tailored to its purpose. To that end, I am proud to announce a pilot initiative with 3 bold components for strengthening our response to mental health calls. The first component will improve and expand upon our co-response model. For 10 years, the Boston Police Department has partnered with BMC's Boston Emergency Services Team, also known as BEST, to pair police officers and mental health workers to respond together to mental health calls that present a public safety risk. Co-response has shown to divert individuals with mental illness from the criminal justice system and the emergency room and to connect them to care that they need. Currently, co-responders can be asked to respond to any call type, ranging from traffic accidents to noise complaints. The pilot initiative will dedicate co-response cars to calls likely to have a mental health concern, so that we are making these mental health teams available for the calls that would benefit from their presence the most. This aspect of the pilot begins in October in Boston Police Districts A1 and B2, representing downtown Charlestown and Roxbury neighborhoods. The second component is an alternative response. This is for mental health calls to 911 that do not pose a risk of violence. The alternative response teams will pair emergency medical technicians, or EMTs, with mental health workers. This approach does not involve police officers and has been implemented in cities across the country. This frees up police officers to focus on violent crime rather than on mental health calls. This work is done in partnership with unions representing BPD and EMS employees. The third component, which emerged from our community listening sessions, consists of community-led responses to mental health crises. These responses will be led by trained community members together with the communities that they serve. In September, we will open a request for proposals for a facilitator who will begin the community process in December. In each approach, we are investing in training for our 911 call takers to improve their ability to recognize behavioral health calls and determine the appropriate response. This mental health response will help us evaluate how to deliver the best possible response for our residents when they are in crisis. These investments will help connect residents and their families with the care they need. They will also help us send officers to where they are needed most. We recognize that a crisis doesn't just affect one individual, it touches their loved ones and their communities too. That is why this effort to improve the 911 response to mental health crises is just part of the broader work to strengthen our mental health system and part of the broader work to promote equitable policing and public safety. In the coming year, the Office of Health and Human Services will launch an initiative to meet gaps in our mental health system coming out of COVID-19, including the need for more clinicians of color, as well as an anti-stigma campaign to raise awareness about these critical issues in our community. The Boston Police Department will continue pursuing the police reforms laid out by the Office of Police Accountability and Transparency, state legislation, and my priorities as mayor. Regular communication with the community will help inform our residents of the ongoing work to bring safety, healing, and justice to every neighborhood in Boston, as well as how we are taking this work from idea to concrete action plans with real benchmarks and goals. Redirecting police officers from mental health calls allows them to tackle and stay focused on violent crimes. Today, I am encouraged that homicides are down 40% this year compared to this time last year. Fatal shootings are down 58% versus this time last year, and non-fatal shootings are down 17%. Obviously, any shooting is one too many. That is why I'm also encouraged by BPD's work to get guns off our streets. 492 guns have been recovered and 372 gun arrests have been made. I want to thank our police department for its work to keep our city safe. Our summer safety plan is working. We are strengthening intervention efforts and suppressing crime in hotspots across the city. In instances where violence has occurred, our trauma response teams are ensuring that neighborhoods are supported and residents are connected to resources to help them recover from incidents of violence. And now I want to shift to our ongoing fight against COVID-19. The Delta variant is the dominant strain of this virus, and it is driving the increase in COVID activity. While cases have risen over the past few weeks, our hospital capacity remains strong compared to the peak of the pandemic in 2020. As of Wednesday, August 4th, we have seen 1,166 new cases in a 2-week period for a total of 72,825. Sadly, 3 new deaths were reported, bringing the overall total to 1,400. Boston's positivity rate is now at 3.4%. We are nowhere near needing to create additional hospital spaces, and that is good news. But on Monday, August 2nd, the 7-day average of adult hospitalizations was 48, and as of that same day, Boston hospitals were reporting a 7-day average of 88% occupancy and non-surgical adult ICU beds. My team continues to monitor the data with a focus on getting residents vaccinated. I want to take a moment to address the comments about slavery and birtherism I made the other day. I wish I had not used those analogies because they took away from the important issue of ensuring that our vaccination and public health policies are implemented with fairness and equity. If vaccine passports were imposed today with a government mandate to ban unvaccinated residents from venues like restaurants or gyms, that would shut out nearly 40% of East Boston and 60% of Mattapan. Instead of shutting people out, shutting out our neighbors who are disproportionately poor people of color, we are knocking on their doors to build trust and to expand access to the life-saving vaccines. We are working hard and successfully, increasing vaccination rates in every neighborhood. We've implemented a mask mandate for our schools, and now we are working with our municipal unions toward a vaccine mandate for our city workers. We will continue to follow the science and the data to protect every resident in Boston. We are boosting vaccinations across the city by partnering with trusted community-based organizations. We are particularly focused on communities hardest hit by the pandemic. Our mobile vaccination efforts are meeting residents where they are and making progress on distribution and access. We are driving vaccine access and information with targeted citywide outreach. As of Tuesday, July 27, over 400,000 Boston residents were fully vaccinated, and over 67% had received at least one dose of the vaccine. COVID-19 is a public health issue, and the response should involve the entire public. We must all do our part to fight the pandemic. Getting a vaccine is the best way to protect ourselves and our loved ones and our communities from this deadly virus. I want to say that again. Getting the vaccine is the best way to protect ourselves from this deadly virus. As mayor, I have placed vaccination at the center of our response to COVID-19 in Boston, and I've invested $3 million to boost vaccinations in communities that are hardest hit by the pandemic. We know that requiring vaccines in public venues will have a disproportionate impact on low-income families and communities of color. So our focus in Boston is to make sure that we are getting those vaccination numbers up across every neighborhood and in every community. I am leading by example with the City of Boston workforce. As I mentioned earlier, we have spoken to our employee unions, and collectively, we are actively working toward a mandate for vaccine or regular testing for all City of Boston employees. Our focus here in Boston is making sure that everyone has their shot at hope, and that means getting the life-saving vaccine. This is what we have been doing since day one of fighting this virus and to get our neighbors vaccinated. Boston is leading the way. That is why we are one of the most vaccinated big cities in America and one of the most vaccinated states in the country. And we are not about to stop now. Now I will take a few questions. Brenda Caselius is leading our school district. As you know, her license has expired. She has acknowledged that, and she has taken steps to rectify that. She is scheduled to take the exam on August 14th. Next question. Sir, next question. The rules do apply, which is why she is working to rectify that. Well, as you may know, we have 18,000 employees here working for the City of Boston. 90% of our employees are unionized. We are taking a very worker-centered approach and a collaborative approach, working with our workforce, working with the labor leaders who represent them, working obviously with our department heads and our cabinet chiefs. We have done the outreach and the calls, and the response has been positive. I believe we all share the concern about the Delta variant, and we all want to protect ourselves. And we are working toward a plan starting with our back to school for our school staff and teachers and others who are working with populations who may be unvaccinated. And we will have more to share next week on that.
Percentage of city workers are currently vaccinated?
Some of our departments have tracked that and others haven't. We know that many of our workers have taken advantage of the priority clinics, which is the good news here. And so we will continue to build upon that foundation to make sure we have systems in place that not only track the vaccination records but offer testing for those who are not able to get the vaccine. Yes, sir. Yes, I am deeply committed to accountability and transparency, and this issue underscores the importance of that office. We need to continue to build up the staff for that office and make sure that the boards of that office are also in place. Records will be released. We will continue to release internal affair files. As we do so, I want to remind you that we will always protect the identities of survivors and victims in this case, and we do not want to do anything that would jeopardize new victims in the future from coming forward. Yes, sir.
City employees, when you first mentioned this, I seem to recall you were talking about mandating vaccines or testing. And I talked to a union official who said, I didn't want to comment at this point because these discussions were ongoing. Is adding testing, is that a concession to the unions that, okay, if some of their people don't want to get vaccinated, they don't have to as long as they're agreeing?
We need to have a rigorous testing program in place to make sure if there are any unvaccinated employees due to religious beliefs or other items that we continue to protect our workforce. The goal, however, is to get all of our city workers vaccinated. That, again, is the best protection against this deadly virus. And the Delta variant is not to be played with. At this point, what we see is there are two options. We can get vaccinated or we can run the risk of contracting COVID. I think we all agree that we want to protect ourselves and protect our workforce. That is the work that we are doing with labor leaders, with our workforce, and with our department heads. Next question. What's that?
What about police budgets? Are they going to be affected at all now or in the future when the program runs out by this change?
So I want to make clear that the investment of $1.75 million is not going to the police budget. This is a way of reallocating funds and making sure that we are responding with public health challenges with a public health response. And so, and I would add that this will not increase overtime in any way. Thank you so much. This money has already been invested in my FY22 budget. Thank you so much. Thank you so much. Thank you, guys.